Hi, my name's Phil. I like talking about politics, and in this video I'd like to discuss the latest example of callous disregard that this Conservative government have for our healthcare workers as they try to justify a below inflation pay award yet again for nurses that actually translates really into a net loss of pay when you consider the extra expenses the government have placed upon them. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So during the Brexit campaign, Boris Johnson and his Vote Leave campaign promised that the NHS would get an extra £350 million a week once we left the EU. This would translate as an extra £18 billion a year. Now, we've had our first budget after we've left the EU and left the single market and all the rest of it. Have the NHS been given an extra £18 billion a year in it? On top of inflationary rises, of course, in the latest budget? No. In fact, spending on the Department for Health and Social Care has actually gone down by £30 billion. So Boris Johnson is cutting spending on the department by £58 billion altogether based on what he promised. And that's not even taking into account inflation. And this would be a grievous insult at any time. But after the past year, where healthcare workers, amongst others, have gone above and beyond is simply outrageous. Nurses have been awarded a 1% pay rise. Not only is this a worthless pay increase, it's not actually a pay increase at all. Because despite more of Boris Johnson's promises, nurses, for example, have to pay to park at their own place of work. These costs were supposed to be abolished by the government. Now, they were for a brief period during the first wave of the pandemic when the beady eyes of the media were on them, but then quietly reintroduced with a big old price hike as well. Now, for many, the cost of this has also gone up. I'll cover that towards the end as well. So the amount of money that nurses are getting for many is actually lower than a year ago. They've had the hardest year of their professional lives and are actually being paid less. That's what we've allowed. And we are allowing it because very few people even realise this because most of the media is refusing to highlight it. And I'd like people to consider something about nurses here. So the same could be said to apply to others in healthcare, of course, but I think particularly acute for nurses. We have a huge shortage of nurses in the country. This has been the case for years. That means, in simple terms, that we don't have enough nurses to supply the necessary care for patients. However, that care has to be delivered. A hospital decides when it's full based on beds, not nurses. Consequence, the fewer remaining nurses have to work harder. Now, let's follow this to its inevitable conclusion. So you have nurses now having to care for more patients because there are not enough nurses. Patient care suffers because they are stretched too thin. This weighs heavily on the nurses who are distraught at the fact they cannot give their best for their patients. Some become so demoralised that they leave the profession. This happens all the time. But because there are more leaving than entering the profession, this creates more work for those that remain. That has been the pattern for the last decade of Tory rule. Then 2020 and the pandemic. So now we have too few nurses facing unimaginable workloads and increasing failure rates because they were under-resourced and understaffed. PPE running out, beds running out. Not only were patients being lost, but colleagues too, as staff were exposed to unnecessarily dangerous working conditions. An absolute explosion of PTSD amongst the nursing profession. Nurses are on the knees, breaking, and all we did was give them a clap now and then. Well meant, but ultimately worthless, and in actual fact worked against them because it helps distract against the real issue. Now our government has given them an effective pay cut. Imagine the effect that that has on the morale of nurses, that we still need to step up to pick up the slack from the government's incompetence. And now imagine this. Conservative Minister Nadine Dorries had the nerve to say that NHS staff were pleasantly surprised by the pay award. That's what she said, pleasantly surprised. The Royal College of Nursing has commented that the pay award is, in their words, a dereliction of duty on the part of the government. The government have chosen to interpret this assessment as pleasantly surprised. I cannot imagine what sort of statement has to be made to be regarded as mildly disappointed, let alone apoplectic with rage, which is actually the response. And the government continue to say that austerity is over. This is austerity right here. Cutting the pay of public service workers in real terms. Boris Johnson said that nurses were getting a 12.6% pay increase compared to 3 years ago. Now, he was basing this figure, which by the way I think is still a little bit wrong, but it's round about there. He was basing this on the rise in the starting salary of newly qualified nurses. Now, the salary of newly qualified nurses has risen more than the average nurse because there's different pay bands. So in your band 5, there's different parts to the scale. But that is not how it works. So I'll do the maths here. And unlike the Prime Minister, I'm going to show my working. So I'll look up the pay award for band 5 nurses from 2017 and now, and working out what it's worth. So in 2017, newly qualified nurses were paid £22,469.87 a year. And the top of the band, the most experienced, £29,190.63. Now the rates are £23,758.51 to £30,864.70. So if it's a 1% increase, I've added that on as well. But hold on a minute, there's inflation. So I've also looked up the rate of inflation since 2017, the year Boris Johnson wants us to compare to. So without any pay increases, the real value of the 2017 pay award, if it had never been increased in real terms, this is what it would be worth now. £23,758.51 for newly qualified and £30,864.70 for those at the top of band 5. That's what the 2017 pay is worth now if it had never actually increased in real terms. So that's what we're basing the calculation off. So then I add 1% onto last year's pay award. What we end up with is an increase of 5.88% for newly qualified nurses and 0.18% for experienced nurses. I have to do it to 2 decimal places, otherwise it looks like there's been no increase at all for experienced nurses. So Boris Johnson's assessment of the pay increase is misleading for 2 reasons. 1, it was only based on newly qualified staff who do not even form the majority of nurses, much less the entire workforce. 2, if you consider it in real terms, his figure is over twice as large as the truth, even for those newly qualified nurses. So that's the reality. Newly qualified nurses have a, to the nearest percent, 6% overall pay increase based on the last 3 years, and experienced nurses, who will have been driving most of the efforts this last year, have received 0% increase. And that's just based on pay awards. But nurses have costs as part of their job. Like I said, I don't just mean transport. As I said earlier, NHS nurses have to pay to actually park at their workplace. Now, I don't know what the average is here because that's not a set scale like their pay, because that's not determined by the government. It's a privatised area of the NHS. But the Daily Mail did reveal a 200% increase in car parking charges for thousands of NHS staff last November. It quoted some as having to pay £1,440 a year just for parking. For doing something that I've never once had to do no matter which school or college I've taught at, pay for parking. Again, can't say what these charges are on average, but as they're a private arrangement, I'm going to guess these charges have increased significantly above the rate of inflation, even given that the Daily Mail's one will have been an outlier. 200% in that case, but that's according to the Tory supporting Daily Mail. Now, add above inflationary increases in parking to a net zero inflationary increase in pay award, and you are mathematically left with nurses actually having had pay cuts over the past 3 years. So no, Prime Minister, nurses have not received a 12.6% pay increase over the last 3 years. The majority have actually had their pay cut. And this is a country that values the NHS and values nursing. What chance would the Conservatives have at the next election if people knew that the government had actually cut NHS funding, not increased it, and cut nurses' pay, not increased it? They would find re-election a very difficult path. But of course, they also know that a complicit media will not let people find this out. For example, The BBC refused to have a shadow Minister for Health from Labour on the same programme as a government minister when talking about this issue. No effort spared in keeping us all ignorant of the damage this government is doing. Except nurses will know what is going on, and the shortages will continue as a result. But by the time the general population wakes up to it, it will be because it has been completely gutted, and what we have left is an entirely privatised and wholly unregulated healthcare system, as the United States has. But those are my thoughts. Let me know yours in the comments below. I hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.